Hello, students. I wanted to give you kind of my perspective regarding working with patients who are post-surgical, have had something surgically done with the shoulder. I think one of the most important things to understand is that even though these patients are in a lot of pain, you really do need to push them as hard as you can when you rehabilitate them. What I mean by that is usually you're following a protocol and you're supposed to bring them to a certain milestone when you're ready to start the next phase of the protocol. So let's say, phase one is you're working with them and you're going to bring them up to have full range of motion by like 3 or 4 weeks or something like that. What you need to do is really, really focus on getting to that milestone. Sometimes things get in your way, and one of them is the pain the patient is experiencing. And it's not that you are not sympathetic to pain, but try to manage that pain for the patient with modalities, with trying to reduce post-surgical swelling. Because if you don't reach those milestones by the time you have to start the next phase, then you are behind the whole way in your rehab. So that's the advice I would give you, is when you're working post-surgically, make sure that you're doing as much as you can to push them to get that milestone, whatever it is, by the next phase. Otherwise, you are just kind of behind the whole way with rehab, and you may not get to those goals because scar tissue will set in, and then you don't really reach what you want to at the end of rehabilitation. So that's my advice.